Okay, my name is Isaac Kwesi Kwam. As Sir Calvin said, today's topic is about alcohol, freedom from alcohol. Now, I'm about to give the introduction about the topic, that is the freedom from alcohol. Whether you view your drinking as a mild problem or a serious one, or even if you are unsure that you have a drinking problem, this guide will provide you with a world of information, ideas and suggestions to cut down your drinking. Now, before you begin, this guide is an educational tool, not a substitute for professional medical help. If you are drinking heavily or have recently had any serious problem connected to alcohol use, seek medical help to determine your treatment needs. Now, fact about alcohol. You are going to learn about the fact about the alcohol. So please listen. If you have any question, then jot it down. About 1 to 13, which is 14 million Americans abuse alcohol or are alcoholics. Fewer than 25% of those who need treatment for alcoholism actually receive it. Now, alcohol and medication interactions may be a factor in 25% of emergency room admissions to one. Brief treatment have been found to reduce alcohol problems for those who are not alcohol dependent. Comprehensive treatment programs have helped many who are alcohol abusers or alcohol dependent. Now, the quick facts. In 2012, 31% of all traffic fatalities were alcohol related. In 2013, 10,076 people died in alcohol-related crashes. 1/3 of drunk driving offenses come from repeat offenders. Traffic crashes are the number one cause of teen death aged 15 to 20. All 50 states and District of Columbia have legal limits of 0.8 blood alcohol concentration for driving. Now, the harmful effects of alcohol. Many adults can drink alcohol in a safe and responsible way. However, drinking too much or as a way to cope with life problems can lead to serious difficulties. Now, let's look at the mental. Poor judgment, confused thinking, difficult remembering, slow reflex, distorted vision, blackout, anger or depression. Now, with the financial cost of alcohol, increased car insurance due to tickets and accidents, loss of income associated with missed work, lateness, loss of concentration, legal costs associated with accidents, payment to person and property, costs associated with any legal judgment against you, costs associated with your medical care. Now, to the social, risk of divorce or serious damage to relationships, loss of friendship, embarrassment for being arrested, mandatory living under the influence, classes, possible mandatory counseling, loss of freedom if converted and sent to prison. Now, with the physical, stomach ulcer, weight gain, hypertension and heart disease, liver damage, decreased testicle size, cancer, balance problem and loss coordinations. Now, what is problem drinking? Problem with alcohol may be occasional or may occur on a regular basis. They may interfere with your life or the lives of loved ones, co-workers, and even strangers. Below are some definitions of conditions associated with problem drinking. Now, alcohol intoxication. When you are intoxicated or drunk, your behavior or thinking may change and become inappropriate. Examples of these include inappropriate sexual behavior, unstable mood, aggressive behavior, inability to function, at work or social. You may also suffer from alcohol intoxication if one or more of the following signs develop during or shortly after alcohol use: slur speech, loss of coordination, rapid movement of eyeballs, issues with attention or memory, or being a daze or coma. Alcohol abuse. Alcohol abuse is a negative pattern of Alcohol abuse is a negative pattern of alcohol use that leads to significant impairment of distress. It may be present in one or more of the following happen within a 12-month period: failure to fulfill major obligations at work, school, or home; use of alcohol or impairment in potentially dangerous situations like driving a car or operating a machine; legal problems related to alcohol, such as being arrested for disorderly conduct; social or relationship problems caused or made worsen by drinking, such as argument with a spouse or physical fight. Now, alcohol withdrawal. Withdrawal occurs when a person stops or greatly reduce heavy or prolonged drinking. The following symptoms may develop within several hours or few days. The first one is balance problems. Second, loss of coordination, heart tremor, insomnia, vomiting, temporal hallucinations, agitation such as passing and fidgeting, heavy sweating or pulse rate greater than 100 beats per minute, anxiety and seizures. Alcohol dependence. Alcohol dependence takes place when three of the following symptoms occur: tolerance for alcohol increases, such as you need more alcohol to achieve the desired effect; withdrawal, alcohol needed to relieve or avoid withdrawal symptoms; alcohol taken in larger amounts or over a longer period than intended; unsuccessful effort to cut down or control use; great deal of time spent or getting alcohol or recovering from its effect; cancellation of important social or work-related activity because of alcohol; continued use despite recognizing physical or physiological problem due to alcohol. Okay. Diaphragmatic breathing. Many people use alcohol to relax or reduce stress in their lives. Learning natural method to manage stress can help control your desire to use alcohol in these situations. Also known as belly breathing. Diaphragmatic breathing can help calm the body and quit the mind. Technique is relatively easy to learn, but it requires regular practice to be effective. Lie comfortably on your bed or couch. Close your eyes and place both hands on your belly. Slowly inhale through the nose and feel your belly rise beneath your hands. Exhale slowly through the mouth and feel your belly gently fall. Repeat this cycle and try to slow your breathing each time. Practice breathing lying down, then progress to sitting and standing. Start out during this exercise for 1 minute, 6 times a day. Work up to 10 minutes to 3 minutes a day. Train daily for 21 days. Rate your stress level on a scale of 1 to 10. 1 lower to 10 higher. Before and after to monitor your progress. My drinking awareness chart. So you can have a drinking awareness chart. Here are the 25 tips to help you cut down your drinking. Agree in advance on the maximum number of drinks you will consume in a sitting, the maximum number of days you will drink per week, the maximum number of drinks you will consume per week. Write these numbers down on a small card. Carry the card with you. Review it before each drinking occasion. Have a severe consequence for violating your limit. Example: for each additional drinking, I will send $100 to Matt. Okay, sorry for that. Keep only small amount of liquor at home. Buy only small amount of alcohol when you shop. Develop interest in activity that it do not involve drinking. Separate your social activity from drinking activity. Example: play softball with your friends, but do not go with them to the local sports bar afterward. Pour small amount of alcohol in your glass. Always leave some alcohol in your glass or bottle. Develop a taste for non-alcoholic beverage. Think about the problem you and others may have had in the past because of excess drinking. Think about the harmful consequences to you and others if you drink excessively. Understand that by the time you recognize you have had too much to drink, it is probably too late to stop yourself. Don't rely on others to monitor or control your drinking. If you are going to be in a drinking situation, leave your credit card at home and take only a small amount of cash with you. Reward yourself for sticking to your limit. Example: see a movie, buy yourself a new shirt, or have a dinner at a nice restaurant. Give yourself a bonus reward if you drink less than your maximum allowable limit. Practice different ways of saying no to people who offer you drinks or try pressure you into drinking when you do not want to. Be willing to leave a place or situation if you feel uncomfortable. Keep a written record of each drink you have, of your thought and feeling just before you are having to drink. Ask yourself, do I really need to have this drink now? If you are drinking to cope with different emotions or problems, learn specific coping and problem solving skills to deal with them directly. Remember, excessive drinking will usually add to rather than reduce your problems and difficulties. If cutting down on your own is not working, be open to seek additional help and support. So these are the 25 tips. Saying goodbye to alcohol. For people who have had several drinking problems or who cannot drink for medical or legal reason, stop drinking forever and may be the only rational choice. Deciding to quit is the easy part. Quitting and remaining abstinent may be more difficult. The next session provides you with helpful strategies and coping tools. The decision to stop. You decide that because of legal, medical, work-related, or social reason, drinking alcohol is no longer a good thing for you to do. You commit not to drink any alcohol or on any occasion for any reason. You see yourself as a non-drinker. You develop other choices and behavior to replace non-alcohol habits in your life. You get professional or group help when needed to deal with the physiological and medical aspect of drinking. Some people can do this on their own. Some will need the help of others. Some will need medication to stop. Detoxification. If you experience several withdrawal symptoms, as the amount of alcohol in your blood drops, you may need detoxification. Is the process of safe removing alcohol from your system. 1. It is for people with several withdrawal symptoms. 2. It ranges from 3 to 7 days. The third one says it is medical supervised. And the fourth one says medication is used to relieve discomfort. It can be performed at an inpatient or outpatient facility. Now, medication. Medication may be needed to help you stop drinking. It can control urges and help prevent relapse. Consult a treatment facility or healthcare provider before using the following medication. Antibiotics. Antibiotics is designed to prevent drinking reflexes. Drinking alcohol when you are antibiotics makes you feel very sick. Even a small amount of alcohol when taking these drugs may result in nuances, vomiting, and throbbing headache. There are many contradictions for these drugs. Check with a qualified physician. Withdrawal. Withdrawal is designed to reduce the desire to drink. Withdrawal may help you remain abstinent. It can interfere with the desire to drink if you replace. As with many medication, it may use as part of an overall treatment program. Reflex prevention. If you have successfully made it through the detoxification stage, your biggest challenge is to remain alcohol free. Sleep versus reflexes. Reflexes. Okay. A sleep is when you have a drink despite your commitment to stop. You recognize the mistake and try not to sleep again. If you do sleep again, it is not for a good time. Reflex is return to excess drinking. You revert back to old pattern to alcohol consumption. Causes of reflex: major life stressor or crisis. Build up of stress. Challenge yourself to see if you can have just one drink. Pressure to drink because of social situations. Difficult refusing an offer of a drink. High level of anger or sadness. To get a better understanding of what your vulnerability might be, try the following exercise. Self-awareness training. Think about the time you felt very vulnerable and in need of a drink in the past. Think about what condition or situation might tempt you to drink now. Final, think about the future and anticipate what might make it difficult for you to remain alcohol free. Make a plan to avoid all the situations you have identified or to manage them in a way that allows you not to drink. Snapping away unwanted edges. The first one is get a thick rubber band and place it on your wrist. Make sure the band isn't too tight. Seeing it will remind you of your commitment to remain alcohol free. Whenever you have a thought or urge to drink, immediately snap the rubber band hard against your ribs. Hard enough to cause some discomfort, not so hard as to cause injury. As thought urge to drink weaken, you can replace the rubber band with thought stopping. Now, thought stopping. Whenever you have an urge to drink picture a big red stop sign. Inhale slowly and deeply. Gently exhale and feel the realization flow. Repeat as needed until the thought of the urge to drinking Relapse prevention strategy. Relax. Learning and practicing one or more of the relaxation method in this guide may be useful. Make changes. Don't hang around with people who tend to drink a lot. Don't go to places where there is drinking. Problem solving. Work on resolving problems in your life early on before they become major stressor. Assertiveness. Practice different ways to say no to drinking. No, thank you. I will pass. I don't drink. I told you I am not interested. Please do not ask me again. Okay, positive mental rehearsal. Positive mental rehearsal involves coming up with new responses to old situations and rehearsing them as an actor who will prepare you for a play opening night. Picture yourself in a situation when you used to drink. Plan what thoughts, words, and action you will take to ensure that you don't drink. Practice 3 ways. Imagine the new you successfully coping. Write out the situation, your desired responses. Make a recording of yourself successfully coping. Another relaxation technique. Progressive muscle relaxation is another popular and effective way to relieve stress, muscular tension, and edges associated with drinking. It involves a series of exercises in which you will tighten, hold, and release various muscle groups in the body. Lift your shoulders towards your ears. Gradually increase the tension in the flexed shoulder muscles. There should be no pain or trembling. Notice the feelings of tightness in your shoulders. Hold for 20 seconds. Gradually release the tension. Notice the feelings of relaxation. Repeat the sequence for all major muscle groups. How to benefit from group treatment. Group treatment can help someone quit drinking, reduce the risk of relapse. Group treatment can serve as the main approach or be part of comprehensive treatment approach. That might also include individual, couples, and family counseling, as well as medication. Finding the right group for you can make all the difference when you are trying to stop drinking. There are two types of drinking: self-help groups and professional therapy groups. Self-help group, Alcohol Anonymous. The oldest and the largest of the program, AA hosts meetings across the country and offers the opportunity to attend meetings every day of the week. A desire. The AA approach is based on 12 steps. Some people have difficulty accepting or adhering to certain steps because of physiological or religious reason. Get more information. Self-management and recovery treatment or training. Based on the scientific principles of rational emotive behavior therapy and other modern therapeutic approach to managing addictive behaviors. Smart emphasis abstinence as the goals of each program. Moderation management, as the name suggests, this program provides strategies for people who want to learn to control their drinking. Now, professional therapy groups, 12 steps program based on the AA model. These groups are similar to traditional AA program, but they are led by professional therapists. Cognitive behavior programs. This method take an individual approach to helping alcoholism or alcoholic quit and stay clean. They include learning to change thought pattern and coping skills. So the tips are: try out several groups if available to see which one may be best for you. Commit to attend regularly. Respect confidentiality and other rules group may have. Understand all the commitment and obligation, cost, time, process for quitting. Have specific goals to graduate from the group. Be an active participant. Complete all assignments given between meetings. Be honest about your progress. Remember, you are there to help, not to win awards. Please others or get approved. Thank you. Okay, a standard drink, beer, wine, and hard liquor contain different amounts of alcohol. One standard drink refers to 12 ounces of beer, 5 ounces of wine, 1.5 ounces of hard liquor. Drinking guidelines. Here are the few wide accepted drinking guidelines. Adults over the age of 65 should have no more than 1 drink per day. Men should have no more than 2 drinks per day. Drinking as few as 4 drinks per sitting, or having more than 14 drinks per week. It's considered heavy drinking and may result in alcohol-related problems. Women should have no more than 1 drink per day. They should not drink at all if they are pregnant. Drinking as few as 3 drinks per sitting or more than 7 drinks per week is considered heavy drinking, can result in alcohol-related problems. Quick note: keep your health care provider up to date on your alcohol intake, since it may have impact on medication and medical conditions.
So my question is that out of all the abstinence methods or the methods of abstinence, which of them is the best? And then my second question is that what is an in and out patient facility? Yeah.
Okay, to me, among all that we mentioned so far, the best thing is quitting.
How do you do that?
By taking the techniques that we made mention of. Better still, don't even get closer to a bar, or when you are going out, make sure you don't take your credit card with you. Maybe if you have your credit card with you, it will push you to go and buy more alcohol. You get it? And when you are going to the cash on you, you shouldn't take more. Just take something small. If it is in Ghana cedis or pesos, just take 50 pesos, put it in your pocket and go out. So that to avoid too much and buying alcohol. Yeah. So you can also do that.
All right, thank you. I would like to add up to what he was saying. I think the best way to deal with alcoholism is you being assertive. Okay. First of all, we got into this by being curious. Me, for instance, I got into it by being curious. Okay. Even in a point in time, I decided to try weed. I told my mom, I just want to explore. See, life is all about exploring, so I love to explore. So I wanted to explore, but I had a talk to, and I had to eliminate the weed. So, like I was saying, it's still being assertive. You know your limits. So if it is 1 bottle, 2 bottles, after 2 bottles, you're okay. You go your way. Don't be tempted. Don't be tempted. Okay, so being assertive, like I said, if you are taking this is what you are taking. After you are done, you don't take extra, and you'll be good to go. Thank you.
Thanks.
He asked 2 questions. Okay, the other one.
Right, thank you, gentlemen. So, regarding his first question, okay, is about what you want to achieve. Do you want to get out of it, that is quitting, or you want to, have the drink, but you don't want to, get into problem. So you don't want to have anything to do with the problem drinking. Several techniques, methods were mentioned to us, but it's about individual differences. What might work for you might not work for me. So let's understand that, okay? Whether you put money, someone can put no money on him, get to the bar, make friends, and then someone will even, you get it? Yes, will buy for, maybe he has friends over there or something. So you just, like they said, you need to know yourself very well, okay? And a lot of the times for some of these things, not many people are able to get out by themselves. Some need professional help. Okay, so all these things said and done, for someone, it might take just a technique. For others, it will take a combination of different methods. This one is not working, the professional will try another one. And at some point in time, the person will be able to, get out of, be in control. So what I would say is that there are individual differences, and you just need professional help at certain times. Now, the second question about in and outpatient facility. We all know OPD. When you go to the hospital, you come out that day. Okay, so the difference is about when you have to stay overnight. So the inpatient facility is when you stay overnight at the hospital, sometimes more than a night. Okay, but when you walk into the hospital, you are sorted out and you come that day. It's an outpatient facility. The in is when you have to stay overnight, depending on the problem you presented with at the hospital. Thank you.
Any question? Brothers. Don't try though.
Thank you very much.
Don't try.
Because I think what I've heard so far is about self. I've not heard about how probably you can help a friend out, an alcoholic friend. How can you help that person out? Probably the person is not even living with you. What measures? Because I think the measures I've heard are about self, but not other people. Thank you so much.
So at the hospital, they might give you drugs as and when they think it's necessary, depending on how far you've gotten with the alcohol. I mean, if you need to be detoxified, I mean, they will help you with that. Yeah.
And then if we think there's a spiritual problem after doing the counseling in the hospital, then you take them to.
All right, thank you very much for the opportunity, sir. So, my question is that in our studies, I heard about one of the measures. In our studies, I heard about one of the measures of abstaining from drinking, and it was about how you're in, like, it's like your speech in the form of, okay, let me give an example. Like, for example, stop, I can't drink, and all of that, you see. So what if you are saying all these words to, let's say, a friend in let's say a bar or any other place where drinking is possible, and then they push you in a way that they want you, like they are forcing you to drink. How will you stop that? Do you supposed to react or leave there or do something that will help you stop that?
Good question. Want to answer this?
Okay, now there is a saying that you can force the horse to the river, but you cannot force the horse to drink water. Okay, now others are forcing you to drink. Individual differences comes in. You choose to drink or not. Your colleagues or friends will influence you. Oh, it's good, you can try it, okay, but it's up to you to decide whether to take it or not. If you don't take it, they may just be angry with you or say anything about you, okay? But that doesn't mind. You have to decide. Is that okay? So with the question, what are you supposed to do when friends or colleagues are forcing you to do it? The choice lies in your hands. Is that okay? Self-discipline is the key. Are you okay? Thank you.
Okay. I think our brother, what he said is true. I mean, you need to know yourself. I'm sure every one of us have values that we esteem or cherish. I have had this experience when I was in my first year, I think 2008, 2009, University of Ghana first year, and I had these men, but they were old, like grown-ups, custom officers. So one was in our room, and all of the times, in Ghana, for such officers, sometimes you need to upskill yourself or upgrade yourself in education, then you get promotion. He had been in the custom office for about 12 years then, and he thought he needed promotion, so he decided to come to school. So I was in my first year, and he was in second or third year, I've forgotten. And there was this party, with these guys. The man liked me so much. A lot of the times he was, giving to support me and all that. I was keeping my stuff in his fridge and a whole lot. So there was this relationship. Just like he was saying, your friends are trying to coerce you into drinking. And that night, at one of the pubs, at the Crawford, when they celebrated, I tell you what, they did everything to make me drink. But you know what? At the end of the day, I ran away from that place. Okay, you don't just let somebody a minute, 30 minutes, or 1 hour change the values you've held. So he said something, discipline. It depends on you. Okay, holding on to, sometimes it's not easy, but just hold on to what you believe. You meet someone for maybe a couple of months, and within an hour, minutes, the person changes you just like that. It's not ideal. So what are your values? Hold on to your values, okay? And that didn't destroy our relationship. I'm telling you, afterwards, still, he liked me. because he understood. He loved to drink, and because he liked me, he wanted me to also get that form of habit. But as at then, I didn't know why I should drink. Our relationship did not spoil. Even after he went to Commonwealth, I think the following year, he would call me, Charlie, come. He would give me money and all that. So some people sometimes give in because of what they are afraid to lose. But this thing, I didn't lose anything. If the person is real, the person should respect you or continue to like you for who you are and the values you cherish. Thank you.
Any question?
Thank you. My question is, first of all, the question is, why alcohol? And the next one is, looking at, we are all gentlemen and we are youth as well. So what role is the alcohol playing in our lives? Because there was one man, he was a military man, and he was someone I pick as a role model. But in the process, whenever there is these big people coming around, he always command a parade. But at a point in time, he start taking alcohol. And in that locality or the environment, everybody dislike him at once. So my question is, so because of that, I pick it up on myself, say, me, no matter what it is, I'm not going to take alcohol. Because it make people look down upon you no matter the kind of person you are. So as gentlemen, why alcohol and what role is the alcohol playing in our lives? Thank you.
Now, from what our brother said, the alcohol have nothing good to give you, to rather destroy you. I was having a girlfriend who drinks. We went to, there's a place called Francophone there. We went there, we were sitting there. She bought it. She was like, oh, baby, taste this. And so, no, I can't. Oh, baby, do it. Oh. You see, when she is closer to me, this girl won't take in alcohol. But when she goes out with other friends, for that one there, she have the zeal to take in alcohol. Let me tell you, if you want to know how alcohol destroy your system, when you get the time, go to the hospital, go through the X-ray. Let them take a picture of your stomach and see how your intestine, it folds. I work in the hospital, so I see those kind of things. It folds like this. So even if you take in water, you get booze. So alcohol will destroy your system. Me, I know myself. I can't take in drink that contain alcohol 4% unless you carry me home. 3 days before I'll be able to open my eyes. Yes, it is me. I know myself. So no matter what, I won't to, because me, I know. And even this downward something that we blood tonic, I took it some time ago. I was playing ball. As if they have that hole in front of me. So if I'm running, then I have to. You see, so my system can't contain this thing. So the best thing is I won't get closer to it. The alcohol won't help you. If you think I'm lying, go to the hospital. Someone has been drinking alcohol every now and then. Take that person to the hospital. Let the X-ray, pay for it, and see how it is. My dad was once a drunkard, and I told him that this is what will happen to you. He said, hey, my son, it's true. And my daddy quit. This same hospital at Kaswa Polyclinic where I worked, a man came through alcohol and car knocked him down. The blood was oozing out as if they have stepped on that place. We are giving this man several drip. Hey, because of the alcohol, he can't. So it will destroy you. Because of alcohol, motor accident, someone legs thin from this place to this place. We are trying to even reverse his leg. He can't. So the alcohol will destroy you. So please, we are very young. Some of my friends say you want to exploit. You can't use alcohol to exploit. You can't. I have friends who drink, I have friends who smoke. I can sit with you, drink and smoke, but me, Kwesi Isaac, I know myself, I won't take it. Yeah, that is me. If I want to exploit, I will use football to exploit. I will use other activities to exploit, but not alcohol. Something that will destroy my system. Okay, thank you.
Okay, in addition to what Sir Calvin was saying, and I'm back to your question, why alcohol? Now, it's not only alcohol. Now, the youth has tended to be doing drugs. Okay, see, alcohol and swim. You understand me? Some will be sniffing glue. Okay, now tramadol, codeine. Okay, diazepam. A gentleman will come to the drugstore, buy a whole strip of diazepam, and take the whole thing. Okay, they'll be sitting and sleeping. Some will be standing and asleep. You understand me? You see, it doesn't really make sense, but you are killing your system slowly. For now, you will see the interest and then how you are enjoying it. Okay, but think about tomorrow. You understand me? A time will come, you'll be very weak. You can't do anything. Looking at our age now, we are all very fit and strong. When your mother gave birth to you, were you like this? You are growing. Now, a time will come, you'll be older, that you can't do anything. By then, you have sniffed glue, taken tramadol, codeine, and other stuff. Now you are weak. You cannot even get out of your room. Ask yourself, where are you going to? Like, you understand? So now, it's no more the alcohol, but boys and girls have graduated from alcohol to a different thing. You understand me? And think about your kidney. Okay? Your other health issues. Guys, let's just advise ourselves, okay? Let's not just consider alcohol because the topic is alcohol, but the other things involved. Let's consider it, right? Thank you.
Thank you so much. Thank you. All right. So I guess that.